Hi friends, in this class we will discuss the mechanism of Plateau Iris syndrome in angle closure glaucoma. What is Plateau Iris syndrome? What is Plateau Iris configuration? What happens in this? The mechanism of glaucoma. What is pseudo Plateau iris and iridoschisis? Okay. Plateau iris, as the name suggests, means that the iris is, uh, plateau-like. So there is a flat iris plane. So if we compare it with the normal one, there is plateau iris. This is normal. This is plateau iris. So what is there here? There is a relatively deeper anterior chamber, the flat iris plane. There is a patent iridotomy or iridectomy, and there is bunching up of peripheral iris in the AC angle. So these are the features of Plateau Iris syndrome. Now why does this happen? So the peripheral iris is anteriorly displaced. So as the pupil dilates, it bunches up and it closes the angle despite having a patent PI. Right? So this is based on how the iris is inserting in a person's eye. Right? So if we consider this is the root of iris, we have ciliary body band, scleral spur, trabecular meshwork pigmented, non-pigmented trabecular meshwork, and the Swalb's line. Right? Based on where this is inserting. So if it is here or pigmented here, there are more chances of getting an attack. Okay, so if we consider this as A, B, C and D, so when this dilates, so it will close this D. When this dilates C, this will close this. So in this sense, the C and D will have more chances of occlusion of the trabecular meshwork, and therefore angle closure is possible despite of having a patent PI. Understood? So this is based on the insertion of the iris. That is Plateau Iris syndrome. Now what is Plateau Iris configuration? So this is actually a preoperative diagnosis. So there is closed AC angle, flat iris plane, and a normal central AC depth. Here the relative pupillary block occurs and it relieves with the PI. Okay, so this is regarding configuration. Then what is pseudo Plateau iris? So pseudo is because of the presence of cysts of iris and the ciliary body. So this one page you can understand what is Plateau iris syndrome, pseudo Plateau iris, and configuration. Understood? So this is very important to understand. Just remember this. Now, how do we diagnose this? It is based on the UBMB scan. There is provoking angle closure with myotics like phenylephrine 2.5% or 5%. When we have with the phenylephrine, then the treatment is with dilute pilocarpine at bedtime and peripheral iridoplasty. Treatment is myotics like dilute pilocarpine at bedtime and peripheral iridoplasty. Now coming to the secondary causes of angle closure glaucoma. So we have discussed in our previous class that angle closure glaucoma can be due to primary or secondary mechanisms, and the primary include this plateau iris pupillary block mechanisms, whereas the secondary is due to some anatomical or secondary ocular or systemic diseases, right? So here we have this something called a iridoschisis. Then what is this iridochisis? So this is bilateral separation of the layers of iris stroma. Typically, it is in the inferior quadrants and usually occurs in 6 to 7 decades of life. So on histopathological examination, there is marked atrophy of iris stroma, which is usually absent or very scant, and there are collagen fibrils at the area of separation, and there is no evidence of vascular or neural alterations. So what is the mechanism of glaucoma here? It can be either pupillary block or, because of this widening, open angle mechanism, because of this collagen fibrils which are obstructed. Okay, then this was regarding the iridoschisis. We will discuss in detail the clinical features and management in another class. Thank you.